Thank you for joining us for another edition of Icon Medical Billing Industry News. For a free assessment of your billing needs, please contact us at 888-678-5597 or at our website, iconmedicalbilling.com. $430 million worth of false Medicare billing fraud. In recent news, the HHS, or Health and Human Services, announced that 91 people from 7 U.S. cities were charged with $430 million worth of false billing Medicare fraud. Attorney General Eric Holder and Secretary Kathleen Sebelius said that those charged included doctors, nurses, and several certified healthcare professionals. Those accused were found to be involved in conducting fraudulent schemes in billing Medicare. HHS Secretary Sebelius said that the arrests were put criminals on notice that they are cracking down on people who want to steal from Medicare through Medicare billing fraud. The Patient Protection and Affordable Care Act, or more commonly known as Obamacare, law gives new tools to better fight fraud and strengthen the Medicare system. In addition to the arrests made, HHS used new authority from the healthcare law to stop future payments to many of the healthcare providers suspected of fraud, saving Medicare resources and taxpayer dollars from being lost to fraud in the first place. Attorney General Holder said, "The enforcement actions reveal an alarming and unacceptable trend of individuals attempting to exploit federal healthcare programs to steal billions in taxpayer dollars for personal gain. Such activities not only siphon precious taxpayer resources, drive up healthcare costs, and jeopardize the strength of the Medicare program, they also disproportionately victimize the most vulnerable members of society, including elderly, disabled, and impoverished Americans." Several of the accused either surrendered or turned themselves in following the declared indictments nationwide. The charges included home health care fraud amounting to over $230 million, mental health care fraud of about $100 million, ambulance fraud of over $49 million, and several other charges in different medical fields. There are 30 healthcare providers who were suspended and facing administrative sanction. These resulted after inspectors analyzed evidences of fraud. Payments were stopped by the HHS as authorized by the Affordable Care Act until further investigations are resolved. The Department of Justice and the HHS Medicare Fraud Strike Force created a multi-agency team of local, state, and federal government prosecutors and investigators with the goal of fighting Medicare billing fraud using Medicare data analysis techniques. A team of takedown enforcers included 500 law enforcement agents from the FBI, HHS, OIG, Medicare fraud control units, and other enforcement agencies. There is apparent conspiracy to commit healthcare fraud with violations of the anti-kickback statutes and money laundering. The investigation unraveled different fraud schemes, including a series involving activities and medical treatments and services such as ambulance services, durable medical equipment or DME, mental health services, home health care, physical therapy, occupational therapy, and psychotherapy. Medicare billing claims were submitted using fraudulent schemes with fictitious or unnecessary treatments. The accused were found to have paid cash incentives to people who supplied beneficiary data that was used in a fraudulent Medicare billing.